Hi, my name is Sharifah Sekalala, and I'm excited to be here with this delightful group of panelists. I'm going to talk to you today about human rights and the impact that it's had on the COVID-19 crisis. Human rights are really fundamental to the way in which countries behave, because every country in the world has signed at least one human rights treaty. And what human rights present are these universal frameworks that help us advance health and justice. They help to transform things that we might have thought of traditionally as moral imperatives into things that we now think of as legal entitlements. And so I think that it's quite important for us to think about human rights during the crisis. The HIV/AIDS pandemic really underscored the need for this rights-based approach as being one of the most effective ways of achieving public health. And what it did was to help us to realize this linkage between health and human rights that we can now use within this current COVID-19 response. So when this crisis began, it was considered this great equalizer. So something that affected rich and poor the same. But as we have seen from the last 10 to 12 months of the crisis, is that actually COVID-19 is still not an equalizer, and it has affected countries and people within countries very disproportionately. And the advantage with human rights is that it really gives us that space to think about the vulnerable and also to take inequalities seriously. And so I'm going to spend a bit of time thinking about ways in which human rights can help us to think about some of these questions. So as we've seen from this crisis, there were some people or groups of people who really fared much worse off within the crisis. And I think human rights help us to think about the impact of discrimination against groups of people, so the groups of people that we might leave behind, because society has discriminated against them. They might be stigmatized for all sorts of reasons. And I think human rights helps us to take that challenge seriously and to help us to think about ways in which we can reduce discrimination of groups that might be vulnerable, so that we ensure that, for instance, they test for the COVID-19 virus. They test for COVID-19 so that we know that they have it, so that they have the vaccine, so that they seek treatment. And it really helps us to reestablish and rethink these relationships that might be discriminatory and highlights them so that we can start taking them more seriously. I think the second thing that I think human rights approaches help us to do is that they help us to really think about vulnerable people, as I have said, but I think they help us to think about what we refer to in the human rights field as the social determinants of health. And this COVID-19 crisis has really illustrated that health is not just this one uniform thing. It's really an abundance of these little things that impact on people. And so we see this with people who have precarious jobs being much more vulnerable. We see this with Black communities being much more vulnerable to the COVID-19 than other groups. And we see this in the way in which people who, for instance, do have low socioeconomic status and therefore might need people who, for instance, have low socioeconomic status, who have precarious jobs, as I mentioned before, might be impacted on slightly much more than other groups of society. We see this as well with people on the front lines, so carers, and care really being constructed much more broadly than we had seen before. So care not being just care in hospitals, but care for vulnerable groups within old people's homes, within other settings. And all these are groups that are normally under the radar, but have really been pushed to the forefront by the crisis. And so a human rights approach is really integral, because what it demands that we do is not think about health as a singular thing. It demands that we think about the social determinants such as health, housing, socioeconomic status, race, gender, that all might mean that somebody's health outcomes are worse. And I think that this crisis has done that and has helped us to rethink some of these relationships. The other thing that I think that the crisis has done in terms of human rights is to help us to link the health rights, so these are the social rights, to the economic rights. Because we saw very clearly that economies stopped, we started to think about these economic, social, and cultural rights a bit much more closely to each other, or at least that I hope states will take that more seriously. So most activist lawyers have always thought of these as rights that are interlinked and intertwined. But I think what this crisis shows us is that if we do not have health outcomes that are good, what we end up having is high rates of unemployment, people being unable to work, economies coming to a standstill. And I think it shows us this inextricable linkage between health and all other rights, that these rights are interlinked, and that we need to care about economic rights as well as social rights. And I think that this has come to a forefront within this crisis in many different ways, in the fact that, for instance, pollutants made people much more susceptible to getting the COVID-19 crisis, in the fact that people who could not take time off work spread the crisis, spread the COVID-19. And so we really saw how important it was to have social security as that safety net within societies. It helped us to think about groups that we might miss, who might be precarious, such as migrants, workers, who might usually fall underneath the radar. And I think that this was a really important highlighting for me of the role of human rights within the current COVID-19 crisis. So Antonio Guterres, at the beginning of February, talked about the fact that the crisis also, while it highlighted the advantages of human rights, it also showed another problem, that actually human rights, that the world faced another pandemic, which is a pandemic of human rights abuses in the wake of COVID-19. And I think that we have also seen this in different ways, in which states have used a disproportionate amount of power in order to abuse other people's human rights. And we see this with the way in which states have limited the rights of assembly of certain groups in order to disproportionately impact on them. We see this in the way in which states have targeted some people who they'd always wanted to target before, but then use the cover of the COVID-19 crisis. And I think that that's really important. But I think for me, the one major way in which we see these human rights violations is our failure to think of the vaccine, which is the greatest global public good that has come out of this crisis, as something that we need to share across the board. And so what has happened as a result of this crisis is a high rate of vaccine nationalism, where every country is that can afford it is trying to get the vaccine for itself, and really missing the idea that the right to health is a universal global right. And it really ought to make us think about solidarity, which is rooted in the fact that it is collective. And for me, there are two reasons that I will end with as to why we should think about this idea of the vaccine as this really global collective, global collective thing that is part of our right, that realization of the right to health of everybody. And I think it is this. So the fact that we are not safe until everybody is safe because of variants, for instance, so you might vaccinate against one variant But that might leave space for other variants to emerge. It means that we need to take this collective right very seriously. And I think that that really makes the case for this global solidarity argument. But the second thing is that in buying up more than we need, we are actually using resources that we need for other aspects of the right to health. So that if your country is spending so much buying up 5 times as much vaccine as it needs, what it's not doing is treating cancer effectively, helping social care. And I think that that really, for me, highlights the two reasons why we need to think about assistance and helping other countries, developing countries, really get this vaccine at the same rate at which we are getting it. And I think that that time is now. I'm looking forward to hearing your questions, so comments, and really thinking about the rights to health collectively with you in the talk. Thanks.